American doctor Kent Brantly made headlines around the world when he was diagnosed with Ebola while working in West Africa. He received an experimental drug for the virus before being transported back to the United States, where he was able to recover. Ebola has killed thousands of people, and the battle to contain the virus is ongoing. Dr. Brantly is in Ottawa today talking about the fight against Ebola, and he is joining us now. Doctor, thank you so much, and welcome to Canada.
Thank you, Marcia.
I want to begin by asking, how are you? How are you feeling?
I'm doing very well, thank you. My health has returned to pretty much a normal state. Just need to exercise more and get in better shape.
Don't we all? Now, you were one of the first people to survive Ebola. What can you tell us about that experience? What was it like?
Well, I will say that actually there were a lot of survivors before me. There are a lot of people in West Africa who have survived, and the world needs to remember them as well. Surviving Ebola, I thank God that I'm here today. I think the people that took care of me, both in Liberia as well as when I returned to the United States, to Atlanta, at Emory University Hospital. I'm thankful for Samaritan's Purse and all the efforts they put into getting me back to America and back to my family. It's a very much a feeling of gratitude for having survived.
And an experimental drug was used on you, ZMapp. Were you aware that doctors were going to use this drug on you that had previously only been used in monkeys? And what did you say at that point, if you had any say in your health care?
I was aware. I had a discussion of informed consent with my doctors and with some scientists who were there who knew about the development of ZMapp. And they told me about the monkey trials and the results of those trials, and made it very clear that this drug had never been given to another human being, and we don't know how it will respond, how you will react to it. It could be dangerous for you. But I was still well enough at that time to be engaged in that conversation and to tell them that if that drug was available, I would be willing to receive it. And when the time came, my doctors were the ones who made the decision finally to administer it to me, and I'm thankful for that.
We heard you speaking a few minutes ago, and you said that Ebola must be snuffed out. We must show compassion for our neighbors. What is your message to people that are watching this, people really around the world, when it comes to containing and eradicating this deadly virus?
This is a global issue. This is a global concern, and we as an international community must take action. And people ask, what can I do? The average citizen can do a lot of things. You can pray for the people of West Africa. You can give financially to organizations that are on the ground fighting this disease on the front line. Samaritan's Purse, MSF, International Mission Corps, Medical Corps. There are a lot of organizations that are on the ground fighting this disease, putting themselves at risk, and they need personal support. They also need financial support, and so giving is a very real way to help. And for medical professionals, doctors and nurses and physicians assistants, their skills are needed there on the ground. And so volunteering with one of these organizations is a very real and tangible need to bring this outbreak to an end.
Dr. Kent Brantly, we thank you very much for your time, and we're so glad that you're doing well.
Very much.